Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and my wife will be here shortly, and Steph, our producer, and there's my wife right now. So I'm going to move over and make room for her, and we are streaming live from the Moses Lake Professional Pharmacy Studio, and you do not want to miss out today's episode. We have Dr. Scott Schroeder, who is a podiatrist out of Wenatchee. He's a local guy there, and he's been practicing for over 30 years. And for the last 5 years or so, I have been talking to him about metal allergies and how it affects patients when they have surgery hardware or dental hardware in their bodies and how it affects them. So we are going to talk about that today. He is an expert in this field. Not only does he have a busy clinical podiatry practice, but he is an expert in the field of metal allergies, and he does talks all over the world. I think recently it was just Turkey, and he's talked in England and Hawaii and all over the world. So you do not want to miss out on this episode, because he's going to give some patient examples also of how somebody's health was drastically changed when metal hardware was removed out of their body because they were actually allergic to it. So it's a very, very interesting subject, and Dr. Schroeder spends a lot of time on it. He's doing a research project, and I think in the end, his end goal is to also write a book about it so he can educate others about this topic. So Dr. Schroeder, without further ado, welcome to our show.
Thank you very much, Shawn, and hello, Janet.
Hello.
Yeah.
So, Dr. Schroeder, tell us a little bit about how you got into this subject of metal allergies.
Boy, it happened, 15, 20 years ago with just patients, listening to patients. I had this patient. She was in her early 30s, and she had two daughters, 8 and 10. And I had operated on her foot and had 2 stainless steel screws in her foot. And then she was complaining that she could not button up her blouse, could not open a door with one hand. She had to use 2 hands. And I was kind of going, that's kind of weird, And then I removed the screws from her foot, and instantly the next day she could button up her blouse, she could open up a door, no problem. And then the following year, I operated on the other foot, and exact same thing happened. So I'm going, something's
Right.
going on here. So I started paying more attention, and titanium kind of came into play more. We were using more and more titanium. Previously, it was just stainless steel, and was seeing problems with titanium also. And then one gal who was quite prominent in our community here, I had operated on her in May. And we were planning at that point, she had what are called these locking plates and screws, which are a little more prominent, and they can rub on shoes. So at that point, we were getting them out. Prior to that, it was okay, 50% of the time, if something rubs or irritates, we'll get it out. And if not, we just leave it. And now with these locking plates and screws, a little more prominent, very good for healing. But so I was getting them out more, and we were planning on getting hers out, in the fall. And she comes in for her pre-op to get it out, and one of the gals says, "Boy, she's not in a very good mood." And so I go in there, and I've known her for years, and I go, "What's going on?" And she goes, "Oh, yeah, I'm just stiff and sore all over. I can hardly get up from a sitting position. I can hardly move my neck. They just don't know. I just feel like I have the flu all the time." This started earlier in the summer. And I've been to 3 different doctors. Nobody knows what's going on. They're sending me to a specialist over in Seattle. And so I go, that's weird. I've seen some things, that are, somewhat dramatic, but not that dramatic.
Mm-hmm.
And so anyway, we go ahead and we get the hardware out later the next week. And then the following week, 4 or 5 days later, I see her back in the office. I go, well, and she had a little bit of soreness in the foot too. And so I go, well, how's it going? She goes, oh, the foot feels fine. And I go, no, what about everything else? She goes, oh, it's all gone.
Wow.
And this was 4 or 5 days after removal of the hardware, where she had all these symptoms for months that nobody could figure out. So that kind of really heightened my desires to learn more about this. And that was probably about 15 years ago. And so that's where I started looking, paying attention, asking questions, knowing the questions to ask. Because, that's the thing with this. Nobody really knows what questions to ask or how it could be, how could a stiff neck be related to, metal in the feet? or ankle. And so it's been pretty dramatic that way.
Janet, what kind of questions do you have for Dr. Schroeder on the subject?
Well, so since that, are you seeing a trend with other clients that have had to have removal of metal when they're in your office? Is this an ongoing trend, or how often does this happen?
More often than we think. I mean,
Wow.
supposedly, according to the general thought process in the orthopedic community, that this is a rare occurrence. And I've been involved in a study over the past 10 years where I've removed over 1,000 implants from over 400 patients over this past decade. And so far, we're in the 3 to 4% range as far as life-changing symptoms, like
Wow.
this patient, life-changing.
Right.
So, obviously we're still working on that particular study, but it is definitely more prevalent than one would imagine and one would think.
Janet and I were just talking a little bit about, what patients, that some patients might be having issues. They just don't know because they haven't asked the right questions. So,
Correct. Well, it's just a number of these symptoms. And what I'm seeing is a lot of symptoms actually similar to autoimmune issues. When anything mimicking, different types of arthritis, what I have seen is it exacerbates inflammation. So whether it's in the joints, I've had patients that have had pain and stiffness in their hands, and then I get it, which has been worse, that then we look back and, it came on after I operated on them. And then I get the metal out of their foot or ankle, and hey, guess what? I can move better now and don't have the pain that I had before. I have just recently, I had a patient with asthma, and that I was very surprised. I mean, I didn't even think about asthma. And actually, I'll tell you what, we can just, let's just have you listen to him real quick.
Absolutely.
Because, again, it's nice when you hear a patient describe in their own words what had happened. So let's see how this one works. This was a patient I'll explain it here. Yeah.
All right. We did reconstructive right foot surgery on March 18th of this year, and we placed titanium plates and screws in the foot. And what did you notice in regards to your asthma after that surgery? I was having to use my inhaler as much as once every 2 hours. Okay. And then we got the hardware out 2 weeks ago. What happened after you got the hardware out? Within a few days, I wasn't using the inhaler at all. And then recently we had some local fires with smoke and all that. And how's your asthma been doing during that time? Just fine. Haven't used an inhaler a bit. Okay, thanks.
So that's one I didn't even know about. It's just that he brought it up when we started talking about things. And I presented to the FDA a couple of years ago. And one of the patients I presented was a patient I had operated on, I think in her early 40s. And so she had stainless steel screws in her foot at the time that she had when she was 16. And then she needed more surgery, and she was allergic to nickel. That we were thinking she was allergic to nickel because she had problems with earrings. And majority of the time, if women have problems or men have problems with earrings, red irritation, it's a nickel allergy, which is the most common type of allergy. And so we were, okay, probably have a nickel allergy. Let's use titanium because that's our other options, right? So went ahead and used titanium for the reconstructive surgery in her foot, took the stainless steel out, and she did fine. Did well. And I said, okay, if you have any problems with those screws, and I had, just 2 screws in there. I probably had 3, but in one particular area, if you have any problems, you let me know and we can get them out. Well, she came back 4 years later and said, hey, I'm having a problem with this screw. Can we, get these screws out? Sure. And I'm doing the pre-op on her and I'm looking that she's on all these meds. And I didn't remember that. And so I was just going, well, when did you, why are you on all these meds? She goes, oh, it's for my fibromyalgia. And I go, well, when did your fibromyalgia start? She goes, oh, about 2 years ago. So I go, okay, well, what other conditions do you have? She goes, oh, I have this chronic fatigue. I'm a teacher. I go ahead, I take my students at lunch and I send them outside and I sleep underneath the desk. I go, okay. And I go, well, when did that start? She goes, oh, about 2 years ago. And I go, see, I've been having problems between metals that I have in the foot and other metals in the body. And that's what part of the research that I've been doing. Actually, we've been testing between dental metals and the foot and ankle metals that I'm putting in. For instance, titanium is more positively charged and stainless steel is more negatively charged. And amalgam in the mouth is more negatively charged. Gold crowns are more positively charged. And so basically, when we have these positive and negative charges, then you create what's a battery. Basically, it's a battery in the body. And it was thought that metals had to be touching, but since this research that we've been working on, no, it doesn't have to be touching. And so I had a patient that actually was getting paralyzed. And after I had put stainless steel in his foot, and he ended up being reactive to some palladium in his mouth and his crowns that we found out through some testing that he was allergic to. And we can talk about him later. But so anyway, this particular gal, so then I asked her, do you have any other metal in your body? And she said, no. And I go, because people always forget about dental metals.
Right.
And I go, do you have any fillings? Nope, never had a cavity. And I'm going, ah. She goes, oh, but I have this, this bar behind my lower teeth. And I go, oh, so you had braces.
Oh.
And so I go, when did you get your braces? She goes, oh, about 2 years ago.
Mhm.
And I go, oh. I go, go find out from your orthodontist when you got your braces and when your symptoms started. She called me back later that day. Oh my God, I got my braces at the end of August, and it was the first week of September when I started noticing this chronic fatigue, severe. And then because it took me a number of weeks to get into my doctor, and then the fibromyalgia started after that. So what I will do, I will have you actually listen to her. Could you hear the last one? Okay.
We
Yes,
could.
we
It's perfect. Thank you.
Okay. Yeah. So here, this is what I presented the FDA. Actually, they heard this particular voice memo.
Okay. Around 2016, beginning of, we were having some symptoms with the screw, so we decided to get it out. And then we realized you were having a number of different symptoms, some fibromyalgia type symptoms you were diagnosed with, some chronic fatigue. And we decided to get you metal tested, found out you were allergic to titanium dioxide and nickel and vanadium, both of which titanium dioxide and vanadium were then the titanium in your foot. So we decided to get that out. Also, you had a stainless steel bar with 15% nickel behind your lower teeth. So what happened after we got the titanium plate out of, or titanium screws out of your foot?
So almost immediately after you took the screws out of my feet, I noticed that almost all of my body pain and my migraine symptoms had gone away. And within a couple of weeks, actually all of my rosacea had cleared. So I was able to stop most of my medicines within a month. I think I was taking 18 different medicines for fibromyalgia at that point. And then shortly after that, I made an appointment to take the bar out from my teeth. And since then I take one pill a day for my migraines, and that's it.
Okay, thanks.
So that's her.
Wow.
Mm-hmm. Mm-hmm.
So how do you put this in a study so it's not just anecdotal? I mean, obviously this is very compelling evidence when we have patient testimonies, but how do you put this in a study when, we just have anecdotal like this? So tell us a little bit
Right.
about how the study, how you designed your study.
Right. So I presented to the FDA 2018, I believe. 18 or 19. And it was basically it was a huge panel of all kinds of professors from all over the country and orthopedic docs and researchers, all this. And so I presented, I had 8.5 minutes to present. And in that, I was actually working with a neurologist because I knew at that time I was having issues between the foot and the mouth. And so I was working with the neurologist. Okay, can I use some of your equipment to test this quote galvanic reaction between the foot and the mouth, which I believed we were having, because with that particular patient, the paralysis patient, after it came on about 3 months after I had operated on his foot, put stainless steel in there, he became paralyzed an hour a day, 2 hours a day, three. He ended up, it was a transient type paralysis that lasted up to 10 hours a day. And basically, he was an engineer from Moses Lake, and he ended up being disabled, obviously, from that. And then he ended up coming back, 4 years later, and had another problem. And I saw the swelling over the area that I had the stainless steel screws, and I didn't know he was being paralyzed at the time. They didn't mention it even. And so then that's not right. Let's get those screws out, and we'll use titanium for what else we need to do. So we did. And we ended up having problems with titanium too, but he was able to heal. Anyway, he came back like a week, and then 2 weeks afterwards, and he goes, "Okay, doc." He goes, "Being the anal engineer that I am, I started looking at the time the metal started going into my body." And he said, "I had all these, amalgams, and then these white gold crowns, years ago. And then 8 years ago, I had a ACL repair with a titanium screw. And after that, a couple of years, then I started getting some neuropathy that started in my feet, and then it's worked up." He says, "Now I have neuropathy all over my body. I can poke myself with a pin in the belly, and I can't feel it." And he said, "Then you operate on my feet." And he goes, "I didn't put it together, but 3 months afterwards is when all this paralysis started. And then, like I say, it went up to 10 hours a day." He says, "Then you removed, the screws from my feet." He said, "The next day, I ended up went from 10 hours of paralysis a day to 1 hour of paralysis a day." And then we ended up. I was working at that time with an immunologist from Sweden, who invented what's called the ELISA test. It's a lymphocyte transformation test that tests the lymphocytes from the blood, and challenges it against various metals and concentrations of metals. And then you get what's called a sensitivity index. And then in some of these tests, 2 and under is negative, 2 to 4 is positive, and 4 and above is, 2 to 4 is weakly positive or mildly positive, and then 4 and above is positive. In his particular case, then we found out he was allergic to nickel, and then highly, highly allergic to palladium, which ended up, he had 26% palladium in his white gold crowns in his mouth. His reading on the palladium was 129. So he ended up still being paralyzed then an hour a day. So I'm going, okay, why? Why is he still paralyzed an hour a day? And and my thought process here was that I put this stainless steel in his foot, negatively charged. Palladium is more positively charged. We just created a galvanic reaction between the two. When you get a galvanic reaction, then you start causing increased, faster corrosion of the metals. All metals will corrode. And in the body, they're in a saltwater solution, right? So do things corrode faster in salt water? Yes. And so, and then it's very minute. And most people don't have problems with this, all right? But some of us do, and that's the problem, that some of us do. So it then caused a faster corrosion of that palladium, which then these metal ions got released into his body, which he was highly, highly allergic to, which then ended up causing and what I'll see muscle spasms and that type of thing with some of this, like I say, exacerbation of joints, inflammation, autoimmune type issues. So he ended up, we found that out, and then I didn't talk to him for quite some time, a number of months, and he was going to work on getting the screw out of the knee, which he did, and then all the dental work. Well, I talked to him as in January, and I go, "Well, how's it going?" She goes, he goes, "I'm glad you called me this morning, because this afternoon my wife and I were leaving for a trip to Australia, and we're going to take a cruise for a month and then go to Singapore." And I go, "Oh, wait, what happened?" And he goes, "I worked on getting all this stuff out of my mouth. I got the amalgams out, and then I got the palladium out." He said, "The day I got the last palladium filling out, I have not been paralyzed since."
Wow.
And he had gone to University of Washington, all kinds of genetic testing, went to Mayo, flew himself to Mayo Clinic, even before we operated on him the first time to find out why he had neuropathy. And they basically said, "You have episodic rigid quadriplegia," which they were just describing the symptoms. And they said, "Sorry, you're probably just going to be in a wheelchair the rest of your life." Well, he walked his daughter down the aisle. And I've talked to him not long ago, and he's paralysis free. And this
Wow.
condition is called, I worked with some physiatrists and what have you, and it's stiff person syndrome. Stiff person syndrome. And there's really hasn't been a cure for it. This is another paper we'll be writing up because we just have so much going on all and everything. So
Yeah.
bottom line with that was that then I'm going, okay, I feel there's a reaction between the two. So then I worked with the neurologist to go ahead and, okay, how can I test this? Can I use some of your equipment, And he goes, no. Get a high quality voltmeter and go ahead and get some ultrasound gel. And this was just in vitro at the time. I was going to take a titanium plate and titanium screws, titanium plate and a stainless steel screw, and put them next to each other and then look at the voltage between it in millivolts. And so that's what I did. And the action potential of a nerve fires off at 70 millivolts is what fires an action potential of a nerve off. And that particular, I did it, just an inch apart with actually was a stainless steel plate and titanium. And it was over 400 millivolts between the two. So then I said, okay, well, I want to go 6 feet out because I feel I'm having a problem between the foot and the mouth. So I ran this ultrasound gel out 6 feet. And this is what I presented to the FDA. I did it on Hot Wheels track,
Okay. Yeah.
So it still was 118 millivolts. So,
Which would be enough to fire a nerve and cause pain.
Exactly.
Right.
Exactly. So, and that's what I'll see if I can actually even show. I had a professor fly out from University of Pennsylvania for me to work with her. She ended up having some issues. Let's see how we can do it. So I'm testing between the foot and the mouth now. And I'm doing, when we were back at FDA, I said, I think I can do this in vivo. Because we were talking about, amongst us and some researchers, we got to figure out how to do this in vivo. And I go, wait, I think I can do that because I'm in my surgery center. And if we can reach the dental metals and I have the foot open, then I can test there. And we worked out with the hospital how to get a sterile probe. We just use a cautery probe and cut off the ends to hook it up to the voltmeter. So let's just see. Yeah, here. Yeah. So here is a professor flew out. And then here's basically a porcelain fused to metal crown. Okay. And then she had stainless steel screw in her foot. And here I am testing with this probe to the screw in the foot. And remember, minus 70 millivolts, right? So here was her test, 148 millivolts, right?
Yeah.
Right.
So then I take the screw out and then I'm just testing the bone now. And then here is the reading, and it's plus 60. So over 200 millivolt change. And in her particular case, she ended up having actually a shoulder that she couldn't hardly lift it up. And I've had this happen with another patient too, after she got metal out of her body. Well, because again, it can cause stiffening and spasms around joints or what have you. And so she had problems with actually amalgam filling in her mouth where she was basically disabled for an extended period of time where she went manic and bipolar and what have you, and then got the amalgam out because she had mercury toxicity. And so she actually heard my FDA talk and was going to write a book, and so actually asked me if she could use some of my information. I said sure. And I was impressed with her because after she wrote it, she sent it to me. She goes, "How does this look?" And I go, "That looks great." So anyway, then she got a hold of me later and was telling me the story, and that she does have some arthritis in her shoulder. But then they were telling her that she was going to need a total, shoulder replacement. And she goes, "I just got all this metal out of my body and had problems, and I don't want a total shoulder. What do you think?" And then I started asking her about metal in her body. Well, she didn't know of any others. And then any other surgeries you had? Well, I had foot surgery, but they didn't talk about putting metal down there. And I go, "Well, get your x-ray." Well, then I asked her some more questions, and it kind of, I wonder if there is metal there. And next day she sent me these x-rays with, she did have metal in her foot. And so we get it out. She came over, she stayed with us because I've known her for a while, and stayed with us, and took her to the surgery center and did this, removed the screws. The next morning I go down, and she's 62. She took the ODARC 30 flight out of here. And I went down and she's crying. And I'm going, "Oh, your foot hurt?" She goes, No, but look. And she raised her shoulder over her arm, over her head. And she got dressed that morning. She says, I just got dressed normally, and then I realized I can't do that. And and she ended up having titanium posts in her mouth and a couple. She had previous root canal and some porcelain fused to metal crowns, obviously. And so she's been working through all of that. But in her particular case, that was, you could see how we're now studying this, and we're actually writing this up. And I'm working with a research dentist and two different professors from around the country in writing this up.
That is really, I mean, those stories are very, dramatic and compelling. And one of the questions I have is that, this could really change dentistry. It could really change surgery and how we put hardware in people's bodies. Are you getting any pushback from the dental industry or from surgeons about this? I could see there being some pushback. So
Oh,
can you
sure.
comment on that?
Yeah, well, I want to work with all the, I mean, I'm not going out. I mean, I'm a surgeon, right? I need this
Right.
hardware. So really, it's just being aware of what can happen. And actually, a few months ago, the International Academy of Ceramic Implantology, I had me talk in Las Vegas. And so basically, they're dentists and oral surgeons from around the world that come there. And so they were very fascinated because a number of them have been talking about this for a long time. And one of them said, finally, proof of what I've been talking about is there. Because it's hard to argue with the voltmeter,
It is.
And yeah. So I want to work with everybody. I'm a surgeon. I need this metal. And we don't have some of the ceramics yet. Now in dentistry, yes, we have a lot more options in dentistry, which has been great. And but in our orthopedic world, not so much. I mean, they're starting to develop some, but that was one thing I presented the FDA too, is that, hey, we need more options here. If somebody has a metal allergy, what are we going to do? And we have some that are partially ceramic, but potentially not totally ceramic at this point in time, or there's coatings to try to mask, some of the metals from the body. And it's just finding good functioning implants. Now, the good news is that most people are not allergic, right? Or sensitive.
Right.
Or have these galvanic reactions. But what I've found is that in my patients, as well as others, that when if you have a problem, let's say you have a total knee, and then have ongoing pain around the knee, but everything looks great. And I've been working with some of the orthopedic docs actually on some of this too, that everything looks great, but I have metal in the foot. Let's say there's titanium in the knee, I have stainless steel in the foot. Well, from what I've already presented, well, that could be a
Right.
problem, right? And I've actually had that in cases in the back where there's titanium in the back from back surgery. The surgeons say, hey, that looks great. There's no problem here, but the patient has ongoing back pain. And then I have stainless steel in the foot. And then, well, I tell you what, we have a little bit of time, right?
Yeah, we do.
We okay? Yeah, let's have you listen to this patient because
Please.
this is actually I presented this case to the FDA also. Let's have you listen to it.
Okay, about 4 years ago, you had some back surgery with some titanium hardware, correct?
Yes.
This gal's quite a
And then
character,
had,
so
left knee surgery with also some titanium.
Yes.
And prior to your knee surgery, what would you say your back pain was?
5 or 6.
Okay, and after your knee surgery, you feel it was how much?
10 to 15.
yeah,
Okay.
she's a character.
But then also, many years ago, you had bilateral foot surgery with stainless steel screws. Well, yeah, 5 different surgeries. And those were about how long ago?
Between 1993 and 2003.
Okay. And then you've always kind of had some residual pain with those, is that correct?
Yes, especially if I stood too long at a time.
Okay. And then we recently got the screws out of of both feet. And how do the feet feel now?
They feel fine right now.
Okay. And then how has this affected then your back symptoms? What's your back feeling like now?
My lower back has no pain now.
compared to 10 to 15 prior to this surgery.
Wow.
Okay, thanks.
So, again, in my mind, it's more of the positive negative charge that, and this was actually brought to me by Europe many years ago when they were saying in the dental world, actually, where somebody has a total knee or hip and have ongoing pain, but the surgeons say, this all looks great. Why do you have ongoing pain? And then they get some of the dental metals out, and then the pain, not in every situation, obviously, but the pain, they've had certainly incidents like I just saw where the pain goes away in the hip or knee. And the problem really wasn't the hip or the knee. It was another metal in the body that was then reacting to that.
And that seems to be what some people, when you say they have an allergy to zinc or one of the metals, even just one implant in their body can cause a problem. But it's really when you put two metals with a negative, one had negative, one had positive charge, that's what creates the battery, and nerves start firing. You feel all kinds of pain and inflammation.
Potentially. I mean, I think it can be one or the other or a combination of the two.
Right.
I feel that when you have the combination, like our paralysis patient, that could be a potentially a worse scenario. And it doesn't happen with everybody. I mean, people have all kinds of metals and they don't really in their body and they don't have a problem. I don't think we know that answer, yet, but, so that's why I think the biggest thing is just having an understanding that, hey, this can affect other parts of the body that aren't just local to the foot or the knee or the mouth, and that all of us need to be talking together. And maybe we need a special type of doc, or maybe it's the primary care provider that's understands this more, and then they're kind of the gatekeeper with some of these. Well, you have these metals in your mouth, and then you have a knee, and you're having problems, and understanding that, and then kind of looking at it. But us as surgeons, we're kind of protective of our surgery, right?
Right.
Yeah. So, and have I had pushback? Sure. I mean, but I talk to, when I can talk to the docs, and, and we're all in this together though.
Yeah.
We're all in this together. And, and really in my mind, it's just trying to figure it out. And really the patient really has to be their own best advocate. And that's what's happening with a lot of these Facebook groups, all this now. Where they're kind of going, why do I feel so bad? What's going on with my body? And then they're getting on Facebook and they're seeing, oh, here's these other patients that have the same thing I have. And then, oh, well, they had these clips in from a gallbladder removal or what have you. And then they had issues or, all kinds of things that, again, not everybody's having a problem, but there are a few percent that can have a problem. And those are the ones that their lives can be quite miserable.
So what's the best way that we can the quickest way, the easiest way that we can educate patients about this subject?
I think the biggest thing in my mind is history and looking at when, okay, you didn't have these symptoms before, and then now you're having these symptoms. When did those symptoms start? And did you have something done prior to that in your body? Did you have dental work done, a month or two ahead? Did you have a total knee, a total hip? I mean, foot surgery, anything, where metal could have been placed in the body. And then you start asking the questions. And so it is, you have to have a high index of suspicion, as a provider, as a surgeon, when we're asking, as a primary care provider, of course, I'm way heightened. And, but I mean, that's what I need to do now is ask questions, and then we learn, and not everybody has an issue. And it may not be related to the metal at all. It's just the way that everything functions there. And as far as the implant, or it rubs and irritates, something I have in the foot. Yeah. Mm-hmm.
Yeah. Wow. A lot of, I can see this going a long ways, and there's just I want your research to be done sooner than later. So,
Yeah.
and it sounds like you've been working on it a while, but I would like you to produce something now, and I want to read a book now too. So get your research done,
Yeah, I will give you a little prelude if you want on one of the
please.
patients. Yeah, so this was just a patient recently, actually, that we just added to the study because I have the galvanic testing and everything on her, and she had titanium in her foot, and she I believe, yeah, she had amalgam fillings also, and again, titanium more positive charged and amalgam more negatively charged. So let me listen to her.
All right, so you had some reconstructive right foot surgery with titanium plates and screws, and just recently, this last week, we got the plates and screws out. And prior to that, what did your body feel like?
Since June, I have been experiencing all over body pain, fatigue, joint stiffness, and then nerve pain in the foot and going up the leg to the back.
And what about your focus or?
I've been in kind of a brain fog since the surgery. I thought it was the anesthetic for quite a while, but 4 months later, it really hadn't worn off much. I wake up in the morning and I feel like I haven't rested at all. I get home at night and I just can do nothing because just going to work has been enough, and it's just been mentally taxing.
And since getting the hardware out, what have you been feeling?
The first thing I noticed when I went home was a lot of energy and feeling like I just was thinking clearly. Other than the local pain from the surgery, the overall body pain was gone. My back pain was gone. The nerve pain is gone. The aches, the joint pain, all gone.
All right, thanks.
Wow.
I mean, what else can I say?
I know. I mean, that's it. When you have a testimony like that and you have multiple testimonies, it's what can you say? I just, what my hope is, I want to get all this information out to as many people as possible, because that probably your most compelling story that you've shared with us is the guy that was paralyzed. I mean, imagine if you didn't figure that out. I mean, how many people are in a wheelchair because of that? I mean, I don't know. I really don't know. I mean, I got to be honest with you.
Yeah.
It's that one's really powerful.
Mm-hmm. Yeah. So again, there's a lot of work to do, and so that's what I've been doing. I have a little more time freed up now. I've been working that way to get some time freed up to work with my professors and that are working on the project with me, and our research dentist, and so we'll have that. There we have a bunch. We're going to write up the paralysis patient, with our dental friend in this group, and I mean we have just so much. But these papers take a long time to get together, and you want to do it right.
Right, for sure.
And and I've even had some of the one of the metal companies, the head safety director of one of the metal companies, get in contact with me. Because they want to see what's going on and all that. And and just for, and I, we're all trying to work together, all these, everything. And, so we just would need to work together and try to figure it out and not shut doors. And really, because it's bottom line, it's the patients. It's our patients that, need our help, and we have to try to figure it out together. And so just everybody have an open mind and then ask questions. And so, my FDA talk, I think you can get it, you can YouTube it. I think it's galvanism, somebody put it together, and I think it's galvanism would be a key word there. And then people can kind of see, some of these examples. And like I say, more recently, we've been working on the in vivo study with what I just presented to you here recently.
Well, after we get this edited and put out in the podcast forums and on YouTube, we'll make sure that we provide the link to that talk in our in the YouTube, so people can click on that. So thank you for that. Yeah. So, Dr. Schroeder, as we wrap this podcast up, I want to thank you. For sharing this information. Our goal, as always, this podcast is just educate and empower consumers to take charge of their own health. And I think we've realized that goal today, because there's somebody out there that needs to see this and hear this, because they are, possibly a candidate for the things you're talking about. So, Dr. Schroeder, what do you have a passion for? What drives you?
My dad was a physician, and just taking care of people and then treating everybody like their family. And my wife did have problems with metal in her foot. She had titanium in her foot. We ended up getting her tested, found out she was allergic to aluminum. And so she was also allergic to nickel. And so in titanium implants, the majority of them are titanium, as well as aluminum and vanadium. And then there's a trace amount of nickel in most of the implants, also in the 0.03% range of nickel. So potentially, when you're sensitive to that, it can affect things. So it's just really, and having a passion for patients. When I'm hearing these stories of the 30-whatever-year-old female who was wondering who was going to take care of her young children because she couldn't open a door and she couldn't button up her blouse anymore. I mean, that's quite stressful for somebody. And then, boy, we take the screws out, and I mean, literally the next day. Right. And that's a lot of these things I'm seeing. It is the next day once we get that out. Not everybody. Sometimes it's a longer, response, but many people, it is quite rapid when we, get things out. And I've been getting out, hardware a vast majority of the time now, just because I'm seeing patients come back 15 years later with problems we didn't even know were related to what I had put in her foot 15 years ago. And, one patient, she would touch a door handle and her hand would blister. And, and she just had significant problems and ended up having, and we had stainless, so she found out she was allergic to nickel, stainless steel in her foot, and her symptoms were 40% improved. Well, she had also a titanium neck or a plate and screws in her neck for a fusion. And she worked with her doc for a year, and then they finally decided to get it out. She was another one with the same thing that couldn't raise her arm up. But her shoulder looked great. No arthritis on X-ray, but could not raise it up. And her doc even tried to. Her orthopedic surgeon couldn't raise it up. So she was looking at surgery there, and she got the plate and screws out of her neck, and all of her skin symptoms went away, and then she was able to raise her arm over her head again. So again, anything neuromuscular in my mind in the body, you have to rule out a metal reaction.
Right. So you are recruiting people for a study, is that correct?
No, not really at this point in time.
Okay.
No. No, I mean, we have our studies. It's just putting all the data together and then, researching everything and writing it up appropriately. And that's what's great about one of our professors. She's written 70 different journal articles, and she's editor of a journal. So she knows how this is done, but you have to do it very meticulously and make sure all your ducks are in a row and all that, just for the medical world.
So if anybody has any questions about this subject, whether they're medical professionals or whether they're patients, can they contact you?
Yeah, the best way to do it would be by email.
Okay.
And doing that, and so my email is Scott, SCOTT, Schroeder, SCHROEDER, the number 8 at gmail.com. So, awesome. And I don't know, it depends on how inundated I am, whether I can get back to people or not. Right. And as far as that goes, but at least, working, getting information, and then try to guide some people on, okay, where do you go from here?
Yeah, absolutely. Well, I appreciate you sharing all this information today, Dr. Schroeder. It was very, very enlightening. One of the favorite things I like about this podcast is I get to talk to experts like you across all kinds of different fields, and I learn so much during the process. So thank you so much for educating me.
You're welcome. You are welcome. So.
And listeners and viewers, thank you for tuning in. You've been listening to Health Solutions with Shawn and Janet Needham. Thank you for listening.
Okay, thanks.
Thank you, Dr. Schroeder.
You bet.